everyone, welcome to Move Well, Live Well. We get a number of people that come in here with issues regarding their thigh. And in particular, what they're complaining about is thigh pain, numbing, tingling, tightness, and just an achy discomfort sometimes. And what's going on here with these folks is they're complaining of thigh pain, and what we're finding is they have a bunch of stuff going on in the sartorius muscle. Now, the sartorius muscle is the longest muscle in the body. I brought out Mr. Netter here, the anatomy book, and I can kind of show you what here we go, right here. So this is the front part of your thigh, if you can see that there. This is the thigh, this is actually the right thigh. And you can see this muscle right here, this band of muscle goes all the way down like this, kind of to the inside part of the thigh, and inserts right here on the inside part of the knee. So it starts way up here on the hip bone, or the anterior superior iliac spine is what this is called. It's actually the iliac, kind of right here, right in front of that iliac crest, and goes right down and through here like this, and comes to the inside part of the knee, right there, that pes anserine tendon, that fascia right there on the part of the knee, the inside part of the knee. So they're complaining of pain and discomfort. It could be way up here, kind of this pocket area of the thigh, and sometimes they're getting misdiagnosed as like Meralgia Paresthetica, which is sometimes pain up in here as well, but the Meralgia Paresthetica has pain that goes to the outer part of the thigh. But this comes down like this. Sometimes they have upper thigh pain, see, upper thigh pain, pocket area pain, upper thigh pain in here, and sometimes, and inner knee pain. So right here, the inner knee, right in through here, and inner part of the thigh. That's where they're complaining of issues the most. So what they've developed are trigger points and nastiness going on in there. So how do you fix that? How do you fix that discomfort in there? Well, it's kind of interesting that sartorius muscle is involved in hip flexion, right? This is the hip. So hip flexion, external rotation, kind of like you're gonna sit Indian style. So if you did this, if you're sitting like this for long periods of time, that can flare it up. That can cause those trigger points by sitting like this with your ankle on the opposite leg, like this. So that's the action of the sartorius muscle, is this. Just like that, boom. Or you sit it for Indian style for long periods of time during the day, that can also flare it up. And this is just an interesting tidbit, but it's kind of funny in a way, but it's also called the honeymooner's muscle. I'll leave you guys to think about that as far as what that means, but it's also called the honeymooner's muscle. Anyway, how do you fix that? How do you fix the sartorius? Well, there's a number of ways to do it. I usually tell folks to get their good old handy dandy pin roll, rolling pin, just like this. You can get this at any grocery store for like $5-10. And you take it like this, and you hunt around. Again, as when we saw in Netter, it starts here at this inner part of the thigh, right here. So what you do, you take your rolling pin, and right here in the inner part of the thigh, you hunt around for that nastiness in there, like right there. That's really tender on me, right there. So you're having inner thigh pain, if you're having inner knee pain, this can all be the cause of that sucker. And I usually recommend folks when they're doing this soft tissue work is to do distal to proximal. So you want to promote circulation going toward the heart. So you start far, work your way close. So here you are like this, and just oscillate back and forth on that tender spot, back and forth, right and through there, and slowly work your way up the sartorius. I can feel that right in there. That's tender. Right here. And then you can kind of feel it on yourself. There's that teardrop-shaped muscle, and it kind of follows on the inside part of that teardrop-shaped muscle. So you follow that teardrop-shaped muscle as you come up like this, and now you're getting to the medial part, the middle part of your thigh, kind of in the front. So let me move this down just a little bit like this. So you started here, you work your way like this, working your way up like this, And now you're rotating, you're internally rotating your femur a little bit. Now I'm kind of in the middle part of that thigh, the middle part, this right in through here. And I can feel that tenderness in through there. And I'm working my way up all the way to that kind of that pocket area right here. So I'm working my way up to that pocket area of, see my pocket right here? This pocket area of my thigh, just like that. So start inside. Start inside like this. The inner part, kind of that meaty part of your knee right there. Start inside. Oscillate back and forth on that sucker. And I'm doing it kind of quick, but you can really spend some time in those sensitive areas right in through here using the good old rolling pin like this, okay? Just like that. And I'm working my way up just like that. Now I'm kind of the middle part of my thigh, kind of in the front, and I'm slowly bringing it toward that pocket area. See that? Of my thigh, right in through there. So that's the sartorius. Remember, it comes down from here, see, this part, and goes whoosh, like this, and comes like this. So it kind of makes this weird kind of S shape, if you will. Just like this. And again, what it does, it does this. It's like you're going to put your ankle on your opposite leg, just like that. That's what it does. So that's the sartorius muscle. So, handy dandy rolling pin. I kind of like to use, if you got dumbbells around, just as a good old, just a 5-pound dumbbell. Is that 5? Yeah, 5 5-pound dumbbell, right? And you can get right in here with the 5-pound dumbbell, and it feels really, really good. See? And you don't have to put any weight. This is if you're lazy, which I'm kind of lazy. And so you just only add a little bit of force, and you can really feel the dumbbell working on that muscle, right in there, just like this. Again, you're oscillating back and forth, working from distal to proximal toward the heart, right into here. See that? Right there. Boom, like that. And again, just like the rolling pin, you're just following that tenderness all the way up. And you may run into other tight muscles too, like the rectus might be tight in here, the vastus medialis might be tighter. Work on all that stuff. Because remember, all these kind of work together to help you function. So work on all this stuff. But yeah, you'll find that if you push sometimes on right here, sometimes this tender spot right here, you'll feel that it'll reproduce that medial knee pain or that inner thigh pain you may be complaining about. Or pushing on here, you'll feel that anterior thigh pain or even that pocket thigh pain. And some of that pocket thigh pain is mistaken for Meralgia Paresthetica, when really it's the sartorius muscle. So yeah, you can use a dumbbell. Another one that I love to use too, because I can be really lazy, is this is just a standard barbell. You know, it's about I think it's a 1-inch diameter barbell, and I think this is about 10 pounds. So this is great because I can kind of just, if I'm in here, and I can get that inner part, that outer part of my thigh right in here. See this anterior part of my thigh right here? Just do that. I can get that anterior part of my thigh like that, and I just lay the barbell on it. And I'm not even doing any pressure, and I can really feel that in through here. So again, starting from distal to proximal, I found a spot like right in through here. Right there, there's a spot, and I can just kind of oscillate back and forth on that thigh and slowly work my way up. Just like this. Is that song? I'll be working my way back to you, babe. So there's that. So you just think of that song, working your way back up right here. And then you can rotate inward like this to get that pocket area right here, like this. You see that? With the barbell. You can lie down if you want to. So whatever makes you comfortable. I just brought out all these tools. It just gives you some options to be able to do this. For the inner part of the thigh, you just have it like this. and you have to go into external rotation just like this. So you lie on your side like this, and then now here you are. You can get that inner part of the thigh right here using the barbell. See that? Right in there. And it's great because I'm without any pressure right here, I'm getting, you know, a good downward gravity is pushing this barbell down, and right there, woo-wee, that's a good one. And this may be affecting, like some athletes, this may be affecting your squats because you're having that inside knee pain in here, and it's the sartorius muscle giving you a problem. So here you are, work these guys out so that way when you do your activities, you'll be good to go. So anyway, that is the sartorius muscle. Trigger points in there, work those suckers out. It'll help with your thigh pain. Specifically that inner part of the thigh, close to the knee, inside part of the knee. And sometimes that pocket area right here is mistaken for Meralgia Paresthetica, and a little bit of that anterior part of the thigh as well. Because remember, it spans like this. It's like an S shape. Spans the entire thigh like this. And so it's the longest muscle in the body. Anyway, if you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new to this channel, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button because that'll keep you in the loop with subsequent videos coming here in the near future. And that way you can continue to move well, live well. Also, I know you know folks who are suffering from thigh pain. And it could be the sartorius muscle. Inside of the thigh, those areas we discussed already in this video, share this with them. Sharing is caring. That way they can benefit from this video. Also, give us a thumbs up, give us a like. It lets us know you care. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.